Hello everybody. We'll come on here and explain one of the complications that we see, not a lot, but enough to talk about, and what we cover in our joint and trigger point injection course. Or the complication, one possible complication with joint injections of any kind, particularly small superficial joints like AC joints, or even if you're going to inject around like the medial lateral epicondyle, which we hammer home, is the potential for scarring, all right, or hypopigmentation of the skin. And that's usually related to when corticosteroids that you're using in your solution inadvertently ends up in the subcutaneous tissue. Corticosteroids can be caustic and harmful to subcutaneous tissue, which can cause a range from, depending on how much gets in there, range from a little dimpling of the skin, from lipoatrophy, or in severe cases like if you have a lot get in there, or you're using a high concentration of corticosteroids, actually necrosis of the skin. And some of you nurses may have seen that before, like when you're fixing to give a patient a shot and you're looking at their gluteus maximus back there, and you see a perfect little round kind of dimple in the upright quadrant of the buttocks. That possibly could have been an inadvertent too shallow corticosteroid injection, especially if they have a lot of adipose tissue back there, if you know what I mean. But that's one complication we talk about in all our courses, hammer home, particularly when you're choosing to inject superficial small joints. You don't have to worry about it as bad in large joints, because you're quite frankly injecting deeper, right? Sure, there's a chance of causing scarring there. You may leak out or something like that as you withdraw the needle. So you always discuss it with the patient. It's always a possible complication, but really hit home and discuss it with them if you decide to inject, like I say, the smaller superficial areas, and particularly if you're using corticosteroids with your trigger point injections. All right, injectioncourses.com if you want to learn more. All right, bye.